Ladies and gentlemen, I'm Dr. Wu from Taiwan. I will be the chairperson of this symposium. I welcome you all to attend this great meeting. And today, our major theme is about the osteoporosis. So today we will have 3 speakers, all came from Taiwan. The first one will be Dr. Zhang. And before Dr. Zhang's presentations, I will make a very brief introduction about Dr. Zhang. Dr. Zhang Yifan, the last name is Dr. Zhang. He is graduate from China Medical College, Taiwan, Taichung, in 1998. And after his graduations, he started his residency. And of course, the following is the visiting staff or in National Cheng Kung University Hospital. And right now, he is the senior visiting staff in National Cheng Kung Hospital at the Department of Veterinary Medicine. His major interest is osteoporosis and of course the community health. And he is also the Associate General Secretary of Taiwan Osteoporosis Association. And today, he will give us the talk, and the topic will be presented by Dr. Zhang. And please, let's welcome Dr. Zhang.
Okay. Thank you, Chairman. The topic assigned to me is under detection of high risk of osteofracture in community. So we have about 20 minutes to discuss why or what should we know about the osteoporosis, and how to diagnose osteoporosis correctly, and how to minimize the diagnostic discordance of osteoporosis. We are facing an aging society. Over the past decades, the population of elderly people has increased from 5% in 1950 to 60% in 2050. Consequently, the associated diseases such as hypertension, cataract, heart disease, and bone disease have become major public health problems, and so does osteoporosis, the aging-related disease. The impact of osteoporosis is global and worldwide. Osteoporosis affects 200 million women worldwide and responsible for over 1.5 million vertebral and non-vertebral fractures annually. Spine, hip, and wrist are most common site of osteoporotic fracture. Fracture event was not only a fracture, but also associated with excess mobility and mortality. Across the lifespan, wrist fracture usually occurred in midlife or younger elderly, and vertebral fracture or hip fracture usually occurred in older elderly people. Due to high mortality, hip fracture was also considered death fracture. It's a hip fracture map. The color reveals the level incidence of hip fracture. Red color means higher incidence of hip fracture, such as England and Germany. Green color means lower incidence of hip fracture, including China and India. We found that in Asian Pacific region, Taiwan is the country in highest risk group of hip fracture. However, there were a few countries still no or limited data about epidemiology of hip fracture. So, based on aging-related disease, do we really know about the osteoporosis? The study of Taiwan in 2000 revealed that the nurses for health education, about half of them consider decreased body height by aging is normal, and about half consider osteoporosis easy to find out. However, just half of them know the diagnostic tool exactly. Furthermore, the study of USA in 2000 showed that the patient admitted with osteoporotic fracture, just 18% have the diagnosis of osteoporosis, and just 22% check BMD after fracture. So under estimation and under-detection of osteoporosis is so common. So we should do more and learn more about the osteoporosis. Let's go back to definition and diagnosis of osteoporosis. Because no diagnosis, there was no further management and treatment. This is the accepted definition. Osteoporosis is defined as a skeletal disorder characterized by compromised bone strength, predisposing a person to an increased risk of fracture. We should emphasize that osteoporosis increases the risk of fracture. It's the same between hypertension and stroke. Hypertension not only stands for elevated blood pressure, but also means increased risk of stroke. Traditionally, the diagnosis of osteoporosis is based on bone mineral density measured by dual energy X-ray absorptiometry, we call it DEXA, and non-traumatic fracture history, like this machine. And about DEXA, we should arrange two regions to measurement. Lumbar spine, the one is lumbar spine, and the other is hip. How to interpret this report? We should consider T-score about the three sides, L1 to L4 spine, and the femoral neck or total hip. Select the lowest value of these three sides. For example, the T-score was equal to minus 2.6 about this DEXA report. T-score is used for diagnosis of osteoporosis and is equal major BMD minus young adult reference mean BMD and divided by standard deviation. According to WHO criteria, osteoporosis is defined T-score minus 2.5 and lower. Fracture history was used in clinical practice because the symptoms of fracture is obvious. However, the gap between clinical and the radiographic vertebral fracture has been noted. Clinical vertebral fracture means fracture with symptom, and radiographic vertebral fracture means fracture with or without symptoms. Diagnostic discordance is the difference between radiographic and the clinical vertebral fracture. As we know, half of vertebral fracture are asymptomatic and have been underestimated in our clinic practice. So vertebral fracture assessment was required for minimizing the diagnostic discordance in osteoporosis. We conduct the study to reveal the impact of diagnostic discordance with or without lateral view of thoracolumbar spine X-ray in osteoporosis. This is our study site, Tianliao Township. Tianliao Township of Kaohsiung City is over southern Taiwan. The distance between Taipei and Kaohsiung is around 350 kilometers and served by only one healthcare care unit, the public health center. The total population was around 8,000 residents. Aging population ratio was 23.7%. Subject was randomly sent among 1,040 women over 65 years old from Tianliao Township in July 2009. After excluding death, empty house, a total of 368 subjects were enrolled in the current study. The response rate was 75.7%. Bone mineral density was measured at total hip, femoral neck, and lumbar spine region by DEXA, installed in a mobile bus. T-score for bone mineral density was generated based on a data set from the Asian population. The lateral view of thoracolumbar spine X-ray examination obtained from the mobile bus were interpreted blindly by the same trained radiologist. Vertebral fracture was classified using genome semi-quantitative approach and morphometry in the following manner. Grade 1 fracture is a reduction in vertebral height of 20 to 25%, And grade 2 is a reduction of 26 to 40%. And grade 3 is a reduction of over 40%. Based on bone mineral density, the prevalence of T-score less than minus 2.5 was around 60%, 57.7%. Among 368 women over 65 years old, there was no vertebral fracture history. The prevalence of fracture history was 11.4%. Vertebral fracture were identified by lateral view of thoracolumbar spine X-ray in 188 subjects, about 51.1%. We can make a diagnosis of osteoporosis in 3 models. The model 1 is fracture history plus lateral view of thoracolumbar spine X-ray. And model 2 was fracture history plus DEXAs. And the model 3 was fracture history plus lateral view of thoracolumbar spine and DEXAs. Diagnostic discordance was defined by the difference between model 2 and 3. Of 368 subjects, the percentage of diagnostic discordance was 70.4%. Use a logistic regression model with adjustment for age, BMI, hip fracture history of parents, use of steroid and secondary osteoporosis. Age was negatively associated with diagnostic discordance, while BMI was positively associated with diagnostic discordance. For further exploring the threshold of age and BMI to detect diagnostic discordance, it identically showed that the diagnostic discordance increased dramatically in age less than 7 years old and the BMI above 25 kilogram per square meter. It's my conclusion. Osteoporotic fracture was easily under-detected in community, especially vertebral fracture. The lateral view of thoracolumbar spine X-ray should be aided in older women to minimize the diagnostic discordance in osteoporosis, especially in age between 65 to 7 years old, or with BMI about 25 kilograms per meter square. Thank you for your attention.